Taletrectinib is the only drug that's approved for patients, particularly who are refractory to a prior tyrosine kinase inhibitor, but it doesn't mean that it's the only next generation ROS1 inhibitor. Taletrectinib certainly fits the bill in that it has been shown to work in patients after progression on a prior ROS1 tyrosine kinase inhibitor. And beyond taletrectinib, there are other agents like NVL-520, the data of which has been presented, where you're seeing an agent that can also abrogate resistance, on-target resistance with crizotinib or entrectinib. So we'll have to see what happens with the approval process for these agents. Taletrectinib is ahead of NVL-520. And they've generated a lot of data on the TRUST program. There's also a lot of data that was generated in China. And so we know that there's certainly clinical proof of principle that it's an active drug in this space. And it's reasonable to think that at some point it could get an approval. Perhaps like repotrectinib, it could be both in the TKI pretreated space, but also in patients who have not had a prior tyrosine kinase inhibition. But I think the differentiating factor between taletrectinib and NVL-520 is that the latter is probably the most selective of all of the TKIs that we've discussed thus far. And so the hope there is that we're seeing a much better safety profile because you're not inhibiting TRAC or some of these other kinases. And so, we're seeing early data to suggest that the safety profile looks pretty good from the publicly presented safety profile of the drug. But it's good to hear that there are other options coming down the pike for patients with ROS1 fusion positive cancers. We're just seeing precision medicine bloom in general. We are seeing a lot of these drivers of cancer growth that are now matching patients to targeted therapies. And we're seeing that crossover into other drugs that aren't TKIs or small molecules. So we're seeing the ADC field, for example, where you're going for a particular target on the tumor cell surface and delivering a warhead where you see a lot of activity. And so I think that we're quite fortunate to live in an era where we're much more thoughtful about finding the appropriate biomarkers to match patients with the best possible therapies. And there's a lot of hope for patients who are looking for new treatment options.